Okay, so continuing on the encounter between Nurse Rose and patient Lydia. Lydia is expressing how very overwhelmed she's feeling, and she has 2 small children at home, and she has to think about the prospect of chemotherapy and reconstructive surgery. So Rose is just kind of working through that with her, asking about support systems that she has, and then even going into faith, religion, any practices that Lydia has that might help her that she's utilized in the past to lean on when she's had difficult situations occur. Lydia is able to express that she doesn't attend church, but that she does pray during difficult times. And then this encounter ends with Rose, or this slide ends with Rose bringing up the idea of connecting Lydia to the oncology nurse navigator who will be following Lydia post-discharge, but Rose has the idea of maybe letting Lydia connect with the oncology nurse navigator before she discharged, which might help her put her at ease since she's feeling so overwhelmed about everything that's going on. So in this slide, Rose is able to use 2 of Jean Watson's Caritas processes. Number 6, which is creative use of self and creative use of self and all ways of knowing as a part of the caring process. Engage in the artistry of Caritas nursing. So Rose does this by engaging and exploring the support systems of Lydia, and then also by, at the end of the slide, connecting her, or getting the process starting of connecting her to an oncology nurse navigator before that time would have occurred normally. And then Caritas number 10 is opening and attending to spiritual, mysterious, and existential unknowns of life or death. So by exploring Lydia's faith and giving her, she actually even gives her an example of maybe taking the time when there's no one in the room, when it's a quiet time, to maybe pray to help her process what's going on, something that she can lean on while she's feeling overwhelmed. So we'll move on to the next slide.